evening wherever you are, and welcome to this session today. I am Clara Abu Samra. I'm an instructor of public health at the Knowledge to Policy Center at the American University of Beirut. I'm part also of the multimedia working group for this year's symposium, aside with Leanne Brady, Sana Contractor, and Kenneth Munge. Today I will be chairing the session today, and thank you for joining in. Now, this year's symposium theme is about reimagining health systems for better health and social justice. And when we talk about reimagining health systems for better health and social justice, we think about going beyond the usual process and methods that are currently utilized in health systems, and one of which is tackling upon multimedia. Today's submission are all multimedia submissions, and we will go in details in each of these submissions, and we are looking forward to introducing each one of those. The use of multimedia is dynamic and has the potential to represent knowledge by explaining complex processes and research results. It also supports in research raising awareness and having more of a process of collective decision and for better policymaking. As health systems move beyond the conventional boundaries, multimedia can serve in supporting health systems change through speaking truth to power. In today's session, we will be tackling upon knowledge co-production for better health and social justice in health systems. And when we talk about knowledge co-production, we think about the various key players that are crucial for policy development, policy formulation, reinforcing change in health systems for better health and social justice. Knowledge co-production is an alternative collaborative approach, informing and shaping policy formulation, decisions, and change, and it plays a critical role in deciphering, understanding, and integrating the views of multiple stakeholders. Knowledge co-production becomes a necessity nowadays in reimagining health systems, reforming policies, refreshing approaches to implementation of policy decisions and regulations. Using various multimedia techniques, today's speakers highlight a continuum of approaches to knowledge co-production, spanning the involvement of citizens, community activists, stakeholders, and even policymakers. Today's session will highlight on various processes for knowledge co-production and its role in reimagining health systems and ensuring sustainable change. It will also discuss the use of multimedia in health systems. Our session brings together prominent speakers working in various fields, each of which have contributed to knowledge co-productions in health systems. We will be having an introduction provided by each of our speakers before they proceed in viewing the submissions that they have. And at the end of the presentations, we will have a Q&A session. So please make sure to submit your questions in the live Q&A chat box. We will be tackling upon as much as we can questions that you have as per the time that we have. With that, I would like to invite our first speaker, so Jeffrey Knezovich. He's a technical officer at the Alliance for Health Policy and Systems Research, and he will be introducing the role of embedded research in strengthening health systems, digital long-form stories of change from Ghana and Mozambique. Jeffrey, please proceed with your presentation, and thank you, everyone.
Hello, everyone. My name is Jeff Knezovich, and I'm a technical officer at the Alliance for Health Policy and Systems Research at WHO. I want to start by thanking the organizers for giving us the opportunity to present a new approach that we've been trialing at the Alliance, digital long-form stories of change. So far, with the support of the Doris Duke Charitable Foundation, we have produced two, both focusing on the embedded research approach, which brings together policymakers, researchers, implementers, and communities to co-produce solutions to the challenges that they face. Although I'm the one presenting today, a lot of effort has gone into producing these stories, and I want to acknowledge the folks at Fat Rat Films who led their development, the research partners in Ghana and Mozambique, and the communities and health workers who offered their time to make these stories happen. Embedded research is an approach that has been promoted by the Alliance since WHO's strategy on HPSR in 2013. It can involve a range of methods, but key to the approach is for research to be carried out as an integrated part of decision-making and implementation processes. Some benefits of the approach include more relevant research, better contextualized findings, and the ability to support a culture of data use for learning and resilience. We developed the Stories of Change as digital long forms. We use this format because it provides an immersive experience that can help to tell engaging and complex stories. They are a bit of an antidote to content like listicles and other social media content. They also lean into our digital habits, with social media users increasingly used to scrolling their way through their feeds. Having a truly multimedia format has also allowed us to create snippets for social media, have a traditional publication, create complementary blogs, and more. While the approach has posed its challenges, we found that once people arrive at the stories, the average time spent is over 20 minutes. They truly capture people's attention. Although I encourage you to explore both stories, The Bumpy Road to Better Health from Ghana and Pillars of Strength from Mozambique, today I will be focusing on the latter.
Acho que nenhum de nós se esquece do 14 de março.
Nós estávamos preparados para aquele tipo de tempestade que aconteceu ao nível da província.
Aqui no hospital e outros nossos centros de saúde, não demos muita conta que teria a mesma intensidade.
Chegado aquela hora da tardinha, começou a soprar. E à noite foi o pior.
In the aftermath of the cyclone, many local clinical staff found themselves cut off from district managers, with roads impassable and mobile networks down. In the absence of communication from their managers, they nevertheless acted swiftly. The healthcare staff remained in their posts, improvising and innovating to deliver essential services. They were planning, adjusting, and showing remarkable leadership. They drew on the skills and personal qualities that had been honed at the front line of the health system over many years, and that had been reinforced by a program of embedded research to improve data collection, assess the situation, and create action plans to improve services. Good data, put to good use, lies at the heart of the program.
O registro de tudo que nós fazemos começa na unidade sanitária, em que a pessoa que faz o trabalho é que faz aquele registro. É que depois manda-se para o distrito, e depois do distrito manda-se para a província, depois da província manda-se para o nível central. Então, aquele registro é que depois vai gerar tudo que nós fazemos. Os nossos instrumentos ainda são manuais. Não que não sejam eficazes, mas com a demanda do trabalho acaba trazendo algum constrangimento, porque o colega em algum momento realiza a atividade e depois diz que eu hei de registrar depois. Mas depois, por causa da sobrecarga de trabalho, acaba não fazendo o registro. Então, isto compromete toda uma cadeia em termos de informação.
In addition to improving data collection, the program trains health workers in research, improving their ability to analyze data. Managers are encouraged to review maternal, newborn, and child health data to identify priority problems and their causes. Using this analysis, frontline workers create micro-interventions and action plans to prompt change. These are implemented and monitored.
Os dados nos ajudam a avaliar o nosso desempenho daquilo que nós fazemos no nosso dia a dia.
Quando a gente vem para cá para fazer as reuniões de avaliação de dados, nos abre um pouco a mente, e nos ajuda a melhorar cada vez mais os nossos dados ou o próprio atendimento na unidade sanitária.
E eu me sinto que desde a primeira reunião de avaliação de dados, os meus dados vão melhorando, o meu trabalho também está a melhorar muito.
Nesses 5 distritos que implementamos o projeto Dores Duque, nós verificamos que houve muita melhoria naquilo que são os indicadores e habilidade técnica dos técnicos de saúde nessas áreas. E a enfermeira, cada dia que passa, que ela tem mais contato com o supervisor, com a familiarização dos seus dados, ela consegue mais traçar estratégia para a melhoria da sua atividade.
Dos grandes ganhos que nós tivemos com o projeto Dores Duque foi exatamente isto. De olharmos para aquilo que nós estamos a produzir, criticarmos nós próprios o que estamos a fazer e percebermos que não, aqui nós não estamos bem, aqui devemos melhorar.
Então nós já sentimos que traz um impacto positivo porque nesses 5 distritos conseguimos reduzir a mortalidade materna, conseguimos reduzir a mortalidade neonatal e melhoria do tratamento das complicações maternas, assim como neonatais.
Mas esta componente do conhecimento que é deixado, as pessoas fortalecerem, se o sistema está fortalecido, esta é a parte que a mim mais me encoraja.
Great, thank you so much, Jeffrey, for your presentation. So now moving on with our second speaker, I would like to invite Adriana Almignano. She's a technical officer at GSI, and she will be discussing engaging civil authorities and local leaders for equitable, high-quality immunization services. Adriana, please proceed with your presentation and introduction.
This photo essay highlights key government stakeholders beyond the health system who can have an important impact on improving the delivery of immunization services and ensure the vaccination of every child, everywhere, every year. Civil authorities and political leaders at district and local levels often determine funding for what we call operational costs. Things like ensuring health workers can pay for transport to travel long distances and provide vaccination services in the most remote communities. These issues like funding for what are relatively small operational costs at the local level, but which really do make a tangible difference in terms of whether health service delivery happens or not, especially in these remote areas. This is an issue that may not immediately catch people's attention. So we chose to tell this story and highlight this issue through the medium of a photo essay so that we could try to bring this issue and its impact to life a bit more through photos. So this essay, this photo essay features high-resolution, engaging photos with just brief text that's interspersed between the photos. And this is displayed on a web page that also has parallax scrolling. And that's what you see here with this photo. It's a web design technique that creates a bit of a more immersive experience. So it defines the issue at hand, which maybe, for example, maybe a lack of transport or outreach, which is shown here, or for example, supplies for data management. And then the photo essay basically goes into examples of how Ethiopia and Uganda have begun to engage non-health stakeholders. These are those civil authorities, the local leaders in the community, who often have authority over local budgets. They may have access to in-kind support, perhaps, or even just using their voices or their platform to be able to advocate for immunization. So some of these examples are elaborated on during the photo essay. In one example, there were unused public buildings that were repurposed as new health facilities in Uganda. Or another example where the cost of a new motorbike was partially financed by a local bank, and with the rest coming from the community itself. And so finally, the photo essay concludes by, really reminding the viewer of the importance of this work in order to advance health equity in typically underserved or in the most remote areas. And through advocacy and public engagement on the importance of engaging these non-health stakeholders, using photo essay as our medium, we really hope to bring attention to and ignite action on practical strategies to ensure operational costs for immunization programs are well resourced in the future. Since this work is just emerging, the photo essay really helped highlight some of those case study examples that JSI has seen in this areas. And we really feel that these efforts show promise and early wins, that there are financially and politically viable local solutions to vaccinate children at the last mile. Thank you very much.
Thank you very much, Adriana. So we will be taking all of the questions at the end of the session today. So moving forward, we will be, I'll be introducing our third speaker, Catherine Dagneux, who is a PhD researcher at the University of Antwerp. She will be discussing scale-up integrated for diabetes and hypertension in Cambodia, Slovenia, and Belgium, which is SCUBY, a creative explainer video to engage stakeholders. Catherine, please proceed with your presentation. Thank you.
Hello, everyone. Thank you for the nice introduction, Clara. I will start with our movie, and then I will explain you what's the use of it.
Type 2 diabetes, hypertension. Chances are you know someone who has one of these conditions. They have a higher risk of getting sick. Effective care strategies such as prevention, detection, and collaborative treatment exist. But many who need this care don't have access to it, or only to certain elements. Let's fix this. Welcome to Scooby. Scooby is an academic research project. We scale up the best integrated care package for people with diabetes or hypertension. We do this together with policymakers, people in the healthcare and social sectors, informal caregivers, and patients. Scooby is in 3 different countries: Belgium, Slovenia, Cambodia. Through learning from the work we do in those countries, we and our partners will continue to scale up care and learn from each other about what works, so that as many people as possible live a healthy life. Join us. Let's scale up care.
So now you've seen our introductory movie. So my name is Catherine Dagneux, and I'm part of the Scooby Consortium. And I am responsible for the implementation of Scooby in Belgium. And maybe you wonder, what is the use of such a short movie? And this is what I will explain to you now. Scooby is, as you saw, a project about scaling up integrated care. But other than traditional scale-up projects, where researchers have successfully implemented a project and they want to proceed in scaling it up, we as researchers have not developed the care package ourselves. The unique thing about Scooby is that we start from what already exists in those 3 countries you've seen, Belgium, Slovenia, and Cambodia. And then we try to facilitate the scale-up of the innovative care packages that were identified in those countries. And this is because we really believe there are a lot of different projects who are implemented and are good projects, but never really reach their potential. We believe our approach will be more successful because we really choose the projects that stakeholders in the field believe in themselves. So they will be more enthusiastic to scale it up. And that's really important, that you have stakeholders on the field engaged in your scale up phase. But how does this relate to the movie? Why did we make it? Well, because we do not own a scalable unit ourselves, we really rely on stakeholders we work with in the field. And then I'm mainly talking about stakeholders on the policy level, such as policymakers or representatives of healthcare workers. So this movie we use to engage with them, because we often hold meetings and then we start, for instance, with this movie to set the scene, get their attention, explain them what it is about. It raises the awareness for the problem and it immediately explains what we want to do. So we then can move over to the topic of the meeting. And in this way, we connect with many different stakeholders throughout the 3 countries in order to reach our goal, and that is get a better care for all people with chronic diseases. Thank you.
Thank you so much, Katrien. I believe the presentations today were very interesting, very intriguing when it comes to knowledge co-production, when it comes to utilization of multimedia, specifically for those purposes of really reinforcing and engaging and change, and to showcase what is really happening when it comes to strengthening health systems and reimagining health systems also. So now we have all of those presentations provided, and each of which discuss different aspects of when it comes to knowledge co-production, especially with the utilization of data and how to engage with the stakeholders. How can you build up on those relationships with the different stakeholders to inform change and to make change and to ensure that we reach the objective of any project that is going on. So now we will be moving to the second phase of our session today, which is the Q&A session. So I will be asking our speakers, please, to turn on their videos. So just quickly, I will be sending out this question to all of our speakers. You can go ahead and question it and answer it as you may like. The first question is, what are some key challenges in knowledge co-production, especially when it comes to engaging with policymakers, civil societies, frontline staff, to really reimagine health systems? And how do you think you can overcome those challenges? Any methods, any processes that can be implemented to really ensure this methodology to be integrated? Okay, so who would like to start?
Perhaps I can start. So, I mean, I think what's, often we find that, these stakeholders may have many demands on their time, right? So in the project that we were discussing in Ethiopia and Uganda, these are, leaders at the local level. They are being asked to do, 20 things in the span of an hour even. So they're very popular, very, needed in many different areas. One, I think, engaging with the right people at the right time for exactly what you need them for, and recognizing those demands on their time. And then, really what we have found in terms of overcoming those challenges is engaging them in beginning from planning processes. So for example, for immunization, engaging them in a planning process, deciding when and where services should be, and having their engagement from the beginning. And then, as time goes on, they've already, in some ways been involved in the formation of that in terms of the planning. So it helps engage in terms of continued engagement.
Very interesting. So, so in your case, it's mainly engaging them since the beginning. It's really having them more of feeling the power over the project and feeling involved also in the project. Very interesting, Adriana. So, any other speaker would like to be tackling? So, Catherine, go ahead. I see you move. You want to answer?
I think I totally agree with that we have the same issues and indeed get their time and their commitment to our project. And how we did is staying really close to their needs so that our project is relevant for them. So we spent a lot of time in the first year of our project to really try to understand them. We did a lot of stakeholder interviews, and I went to multiple network meetings where we met them and we saw their challenges so that we could really shape our project to what they needed. And next, another thing, what we do is when we want to engage them, really think good about how you send out the invitation by mail. Do you phone them? What would be good timing for them? A location. It seems simple things, but if you think well about it, it can help to get them where you want them.
Very interesting. I thank you, Catherine, also for dwelling on that. It is very important. I mean, stakeholders have a very big input on most of the projects that are being implemented and ensuring sustainability of implementation later on. So engaging with them in the right way and the right time is very important. Jeffrey, would you like to answer the question?
Of course. And I think that I would start by very much echoing what Adriana said. I think that engaging people throughout the process is incredibly important. And that's one of the reasons that the Alliance has really been taking this embedded research approach, which is about bringing together policymakers. And in some cases, we've had policymakers actually be the co-principal investigators on research studies. And really so that they're working together to actually inform decision-making processes from the beginning. I think, you know, it depends on who you're talking about co-production with and co-production for, obviously. And I'll come to communities in a second, but focusing firstly on this policymaker researcher relationship, there's a lot of I guess a lot of the historical approach has been treating these as two separate communities, and you need to sensitize decision makers and you need to skill researchers in being better communicators to ensure that the research gets used. What this co-production, by putting them together on the same team from the beginning, does is it kind of eliminates the need for this communication training or whatever, because they're already involved, they already know what's going on, and they've set the research questions themselves. So it's a really important relationship. We have more time than I thought that we would, so it's a bit of a shame that we weren't able to show much in the way of both of our digital long forms, but I definitely recommend taking a look through both the one in Ghana and the one in Mozambique, which I think both have a lot of lessons on co-production. So the example in Ghana that I thought is very interesting and relevant to this question is that in Ghana, their project is very much focused on building primary healthcare services in communities. So it's local, community-driven, lots of engagement in communities. And it was very much research-based. They built the program off of a study called the Navrongo study that happened in the mid-90s. And one of my favorite parts of our story of change is they found this model, works great, engages community members, and so the decision was taken that they would scale it up and they would work the same model across the country, and that is where the problem started. Because engaging communities is not, it's not really a one-size-fits-all model. And I think that they realized very quickly that they needed to continue to build in an iterative approach and have more trainings on how do you engage and work with communities and make sure that they're feeling listened to and active participants in the production of the services that they need. And I think the other thing that becomes quite risky with co-production in terms of a challenge that you were alluding to is that we have, there's a lot of risk of over-promising and under-delivering when you're engaging with communities, and kind of and not just the entry, but how you engage and the expectations that you set when working with communities are something that is certainly really important, and I think an important challenge for knowledge co-production. The last thing I'll say here at this first stage is that if you are particularly interested in knowledge co-production, the Alliance does have a special issue of the BMJ, or sorry, I think they call them a collection these days, of the BMJ coming out next week. So we're just about to launch a webinar invite for that. So if that is something that interests you, a lot of these challenges will also be further discussed there next week.
Thank you so much, Jeffrey, for that. Also, do you mind sharing the links with the rest of the audience also through the portal, so they can also look into the different other examples that you have already mentioned also? And I think, so Jeffrey, you have tackled on a very important topic, which is the different communities that we're dealing with, the different countries, the different norms, the different, so everything might be different when it comes to values and concepts and all of that. So how do you think, and how was it even possible to navigate through the different concepts and values of social justice in those different countries? So this question goes to all of you, but Jeffrey, I'd like you also to answer that also.
Well, maybe I should start by also saying that these particular projects were not necessarily something that were supported by the Alliance. These are projects that have been happening with the Ministries of Health or the Ghana Health Service, and supported in particular by Doris Duke Charitable Foundation. So I think that a lot of what that kind of detailed information on how do you consider social justice issues is incredibly important. I can talk about it in terms of what issues did we find when kind of trying to tell the story even, I think is important, because that's also part of this co-production challenge, and how do you incorporate multimedia and things like that, where we had a lot of power dynamics coming in particular as WHO saying, we think this is really important. What do you, how do we help you tell your story rather than trying to just tell the story? And I think that creating spaces for different voices is important, and I think maybe some of these multimedia approaches is a way of dealing with some of those power imbalances. So maybe that's getting on to another question or changing the topic slightly, but it's my first reaction anyway.
Great, thank you so much, Jeffrey, for the answer. So Adriana, just going back to engaging with local authorities and all of that, sometimes we believe that a certain topic might be of important to us, but it might not be of a priority to those local leaders and authorities. So how were you able to pitch in the necessity of the change and of your project specifically?
Sure. You know, I think in some ways, you know, where we have been working is where, you know, immunization has been struggling. So I think, you know, even just with the data, you know, it is recognized as an issue. But, you know, for example, both of these projects also utilized quality improvement tools in order to do problem solving at the local level. So, you know, in some way, there were times where, you know, we started with the problem of immunization and using those quality improvement tools to tackle that problem. And then if they're, you know, after that, these tools are quite flexible in terms of what kinds of problems you can tackle. So, you know, if there were other issues like, you know, home births or some other, you know, health issue, even in some cases they would switch to agriculture, but using you know, those kinds of tools in a way to tackle any range of problems that may be the priority of that community. So our focus was really on, you know, how do you use these tools, using immunization maybe as a test case, and then are there things that could be adapted for other problems that may be, you know, present or prioritized by the community. But I think really that local problem solving and taking that process at the local level is really important. And then, you know, whatever problem you want to prioritize is, you know, it is up to that community.
Very interesting, very interesting. So, Catherine, my question to you specifically, you mentioned more of the connectedness and connecting the different countries together for the scale up. Did you see any differences in the scale up of those projects? Did you see any surprising results when it comes to when those countries were connecting to each other and discussing the project that you have? Because knowledge co-production is not only also involving policymakers and stakeholders, but also the front line, the people who are working on the projects, the people who are at the local level, the society, and the community also.
Yes, we are still we are halfway the project, so we didn't reach scale yet. But indeed, we see a lot of differences between the countries, and it lies a lot within the culture that's in the countries. In Belgium, for instance, there happens a lot from people on the field, and it can be very chaotic, and it takes us a long time to understand what's happening. While in Slovenia, a former socialist country, it's more hierarchical and structured. And in Cambodia, their main goal is to really get the Ministry of Health to scale up the things they want, and they really want to engage them. So we're all in a different context, and that's maybe sometimes it's difficult to compare, but on the other hand, being so different, when we come together and share, it really helps the countries, because you see your own project in a different light if you then check what happens in the other countries, and it's really helpful, even over the world, even in regions that are not close to each other.
That's very true. Exactly. And it's very nice to learn from those experiences also when it comes to that. So I just want to remind, yes, go ahead, Adriana.
Oh, sorry. I was just going to add on a bit to what Catherine was saying. Is the two projects that were in our photo essay, Ethiopia and Uganda, we also had done some cross collaboration, cross learning between the two countries. And, you know, in some ways, the contexts were very different. In Ethiopia, we were focused on nomadic pastoral populations. In Uganda, not so much. So there were very different contexts for implementation that sometimes makes it difficult to see, you know, what can I learn from them, what can they learn from me, what's applicable. But I think actually this is where things like measurement and monitoring and evaluation approaches are also really helpful, because even if your contexts for implementation are quite different, you may be able to have some synergies in terms of, okay, well, how do we measure what we're trying to get to? What are ways that we can tell our story? And so I think, you know, no matter what the implementation is, there are times where that monitoring, the evaluation, the learning itself, those processes or methods, I think usually you can always find something of value and some common ground there of you know, how do we show this impact or understand what's happening on the ground, even if what's happening on the ground is quite different.
That's very true, and going back to what you're saying really reflects back to the current situation that we're all in when it comes to COVID-19, and ensuring that we learn from each other when it comes to measurement, when it comes to implementation, when it comes to even policy making and how to engage with the policymakers and showcase that things are a priority and how to move forward with that. So I just want to remind our attendees that you can plug in your questions. You're using the on-air portal, not the Zoom portal. So you would need to plug in your questions on the live Q&A chat box on the portal itself. So moving on to another question and to the necessity and to more of tackle upon different methods when it comes to reimagining health systems and specifically multimedia itself. So given that this has been put forth, how can we better invest in utilizing multimedia in health systems, especially when it comes to putting the power of evidence in the hands of people closest to the issue that matter, and as a tool more of catalyzing new approaches and collaborations at all levels, whether we're talking to the public, whether we're talking to policymakers, to other stakeholders, even when it comes to knowledge co-production and even beyond knowledge co-production, especially when it comes to reimagining health systems. So how can we better invest in multimedia, and how can we utilize multimedia to dwell more on that?
I think indeed you touch upon an important topic, and that is that often the public is very far away from the field of policy making or from the academic field or the field of research. And although our movie wasn't really made for the public, but rather for the policymakers, we also struggled with keeping it short and catchy and not losing ourselves in details, because when we made the movie and it came back to the researchers, there was a lot of feedback. Oh, this is not really, this detail isn't right and you should change it. But then it becomes too long, and you really want, you need to be short. So that's an important thing, I think, to really place yourself in the field of the people you want to watch or get your communication.
That's very interesting. I mean, you've touched upon a very important aspect of that. Thank you, Katrin. Adriana, Jeffrey, does any one of you want to answer upon that?
Maybe just a quick comment to say that I think, thinking about different kinds of multimedia, so like lower budget options like, a photo essay or the use of photos. And then also, there's just if you're using video, there's different ways to produce a video that can fit different budgets as well. So thinking about, what are creative ways that you can use multimedia that is realistic for any budget, I think is possible.
So did you find, in terms of photos, especially that, so were they able to really showcase what you have in mind and present what you have in mind when it came to specifically your problem or your project itself?
I think, well, I can answer quickly, and then maybe I'd love to hear Jeff's thoughts as well. I think the combination of photos and text was helpful, for our particular topic, which was talking about, funding for operational costs at the very local level. This is something that does not, doesn't get specific attention, but is actually really important. And you hear health workers talk all the time about how they may not have, transportation to go to, a certain outreach site every single month, even though they may be expected to. So, being able to show it in different ways, what does it take to do an immunization session, and then explaining a little bit of what goes behind all of that. That was the strategy that we took.
Great, thank you so much. And I know many people really would enjoy a photo essay rather than just a text. It gives just more of a positive influence to that. So Jeffrey, anything from your end?
Sure. I've been involved in kind of the multimedia strand with these HSR symposia for several iterations now, and that's because I think that multimedia can have a huge role in different aspects of HPSR, and I think that we see that in different examples today, but also in other parts of, in other sessions that we've had this year and in previous years. And I think that a lot of times the default vision or the first thought that comes to mind when you think of multimedia for research is that it's actually for some sort of advocacy piece. And that's absolutely something that can be an important advocacy piece. And I think that has a really important role to play, especially when you're trying to, help decision makers or researchers really understand a topic or put themselves in the shoes of, for example, service users or whatever. But I think that there's also a lot of multimedia tools that we see used as part of the research process itself. And I think things like photo voice, where there's kind of training and work with people to be able to really tell their own stories and kind of discuss and reflect, or some of the life histories that we see, I think can also play a really important part in capturing the research process itself. So I guess, again, second what Adriana has said in terms of it doesn't all have to be some really fancy thing. There are different ways of approaching it that all pose their different challenges, but that can really inform different parts of HPSR. And I think that what we see, one of the great things of the last 20 years has been the revolution in different technologies that allow us to capture lives in different ways and in our hands, with mobile phones and things like that. And that has a possibility, obviously, in the best of times, to kind of democratize that process, to shine a light on stories that might not otherwise get told. But and I think that we might talk more about this. There are different power dynamics that might continue to exclude different voices, and the digital divide is certainly one of them that is still very prevalent. So I think I've meandered a little bit on that question, but hopefully.
Thank you so much for that, Jeffrey. Yeah, well, we're moving to a different kind of world. We're moving to more of a virtual world also. People enjoy multimedia. Policymakers are getting more used to that. And it's really important to start more on investing in this and understanding more and getting the experiences of how this is really utilized to reinforce and to reimagine health systems for better health and social justice too. So we've got a few questions from our audience. So I will start with the first question. The first one is how we have found that policymakers are open to collaboration until the content gets too political. This makes speaking truth to power almost impossible. Resorting to more traditional activist methods can negatively impact long-term relationships with policymakers that are important to enable change. But some urgent issues, especially during COVID response, require short-term interventions. What role do you think multimedia can play in this case? Okay, who'd like to answer?
So I guess I'll jump back in, and I have to judge my words carefully here. But I think that, as with all different types of activities, there's no one silver bullet. So I spoke a little bit of some of the advantages of working on multimedia. In multimedia projects, they bring stories to life. They can bring in voices that don't often get heard. That can cause its own problems, as I think has been suggested here by in this question. And so I guess I would go back to, you know, the notion of this session, you know, in the title, the co-production. It's a lot about relationships and managing relationships, and it's not just about presenting a final product and saying, yeah, here's the thing, and being confrontational. It can be about using it as a way to open a conversation, saying, okay, so we have this bit of footage that shows something, and having a private conversation with the people that you're trying to influence and say, well, should we include this, or how can we include this, or, you know, not everything has to happen in the public sphere and be adversarial, would be a first reflection.
Exactly, and something also to reflect upon is, especially when it comes to the COVID response, many people are really influenced by multimedia, by what is being presented out there, whether it's through a video, through a podcast. People are listening through it. We're always online. We're always listening to what's going on. And so, Adriana, mainly just reflecting on what you have done also, and now with the discussions of vaccination, COVID-19 response, and all of that, how do you think multimedia can really be, based on the experience that you already had, also really of importance when it comes to that?
Yeah, it's a big question. You know, in many countries, health workers are, as we know, going to be among the first in line for COVID vaccination. So I think even with health workers, you know, not making the assumption that every health worker already has all of the information that they need, but understanding that they are also a group that needs, you know, to be well informed by sources that are trusted, that are factual, and so that they then, you know, can be advocates for example, COVID-19 immunization in their communities. And I think the importance of that shouldn't be overlooked. That, you know, health workers also can be bombarded by, you know, media that we've seen, and you know, they have every right to, you know, want correct and factual information, and to be able to make decisions for themselves. So I think, you know, that can be a starting place as well, and not necessarily overlooking that, you know, those who are the first in line also, you know, want to know what is the efficacy of the vaccination that they're taking, you know, what has been found in clinical trials, etc. So I think that's an important piece that doesn't necessarily has not been looked at as much.
Yeah, yeah, and it's quite important really to more of utilize the different methods that we have nowadays, also to reflect back on that specifically also, and involve healthcare workers into those decisions also. So Katrine, we've got a question for you. So someone says, love your graphics and it's such a cool animation. Can you tell us more about the process? How did you pull it together, choose the images, etc.?
Yes, it was together with a designing company. So we didn't do it as researchers ourselves. They're all from Barcelona. And we started with making, there is one researcher in our group who is more used to making this kind of movies. So we first draw the story which we wanted to tell, and then they chose the graphics. And then in the end, yeah, there went a feedback loop back to all the different countries. Important is that, for instance, the humor we use in Europe may be not understood well in other parts of the world. Like we had the monks to visualize Cambodia, and we gave them sunglasses, but that was something that you don't do there, which we didn't know. So it's very important to have feedback to change again. And then the last step was choosing the voice. So you have different voices, and then we chose a voice that was trustworthy. That was important for us, but still get some attention.
Yeah. So, Katrine, I think you've dwelled on something that is quite many of us face, and I'd like to know more about that process. So once we're coming to develop a multimedia product, we have all of this information that we want to portray in just a few minutes, in a picture, in a video, whatever. How are you able to just summarize all of this information in a very pitchy video itself?
I think important is to start from the problem. What we often do is research is when you write an article is methodology, results, but when you present like that, it's better to really start with what's the problem we face, and then come to the solution and to the use of that solution. That's a good way to do that, and then just delete delete a lot.
Start deleting off all most of the information.
Yes.
So we've got another question. So while multimedia can add a lot of value to health policy and system research, it can also reinforce power hierarchies. How did you work with your collaborators to allow for knowledge co-production that takes these power hierarchies into account? As the storyteller, how do you work with this, especially when working with colleagues in other countries? So I think all of you can be answering this question, because this goes across most of your presentations also.
Maybe I can just start with a couple of comments. I think, you know, maybe touching on what Jeffrey said earlier about managing relationships, I think it's also in the way that you bring people together. So, you know, recognizing if you have people with maybe different levels of power in the same room, you're only going to hear from some of those voices in the same room. So if you may need to have a different strategy of a, you know, more one-on-one conversation with different groups. So thinking about how and when you bring people together, I think is important in that process. And recognizing that, continually recognizing of, you know, who are we hearing from, who are we not hearing from, and then thinking about other ways that you can, you know, try to elicit a bit more out of these different groups.
Yeah, that's true. And especially when it comes to hierarchies also, it's really important to know specifically what is being said and to whom it's being said and at what time also it's being said. Any one of you would like to answer this question also before we move to the next question?
I agree with all what has been said, and one important thing, but that's much more difficult in these times, is come together and see each other, and because it's always different and much more useful when you see each other in real life than on a virtual way.
Yeah, that's very true. That's very true.
I think this is a really important question, and it was something that was very much at the forefront of our minds as we were developing these stories. And absolutely, it required a lot of discussion and negotiation and building trust with people, having more conversation, figuring out what boundaries were, and that sort of a thing. To the extent that we worked with the team well, so first of all, we put the call out as an open call for anybody in the world could bid to make these digital long forms. In the end, the one that was selected on technical merit was FatRat, which is based in Barcelona as well. Apparently they have a good creative industry, huh? But they, it therefore created automatically, again, some of these north-south power dynamics and things like that. We explored getting local photographers and things like that, which again was an interesting one because, for example, in Ghana, we asked the team, are there more local people that we can work with? And they suggested people that ended up being more expensive than what we could what they could bring from Barcelona, effectively. And so even that was its own kind of dynamic, but we had to, you know, it was one of those things where the team was saying, well, why didn't you go with our suggestion? And it had to be, again, part of this open and frank discussion of, well, because they were charging an arm and a leg. And, you know, part of the, you know, obviously, these different things matter. We put together some guidelines even as we were developing these different stories in terms of how do you enter communities, and because and what does consent really mean? WHO has pretty strict standards on consent for participating in videos and things, because we have effectively a global platform. And you know, that's easy to say in theory, like, yes, everybody should have consent at the before you start filming, and then when you get on the ground and you have 1 minute or 1 hour to capture all of the different footage that you need in a particular situation, it becomes very hectic. And how do you do that? Can they sign consent forms? Can they, even if we have it translated into Portuguese in Mozambique, in Ghana, there were literacy issues, so there was a lot of verbal translation and things like that. So again, I guess that's a very long-winded saying of it's all very much a negotiation process, and I think the important thing is always to be reflexive as you're and build at least that reflection in as part of the process of developing these stories as well, and making sure that you're not reinforcing hierarchies as best you can.
Yeah, and Jeff, I think you talked about a very important topic when it comes to consents, and that makes me think back to did any one of you have any more of ethical considerations that you really need to take into consideration before creating your videos, before filming people, before involving them, before taking pictures of them? Was there anything that you had in mind that you need to take into consideration? I know consent was one of them, but are there other challenges that you had?
I think immunization is pretty innocuous, so we were lucky, you know, with just the normal kind of issues of consent in terms of being using photos for the multimedia. But yeah, you know, I think it depends on what the issue is. Certainly, there's you know, a whole world of ethical issues with more sensitive topics, but with immunization, I suppose we're a bit lucky. Not as controversial, not always, at least.
That's great. Sometimes with ethical considerations that really need to be taken into consideration before any multimedia is really developed, it might shift to the other way around if it's not considered or even put in place while a multimedia also is developed. So. Yes.
I mean, I think that it's something that off the back of the production of these, we started creating our own checklist of things that we needed to be concerned about, and I think that it's something that I think that we would love to have a further conversation about. So if there's other people that are interested in talking about the ethics of multimedia in HPSR, I think that we should definitely get together, because yes, consent is tricky, and consent can vary. Even when, especially when you're looking at health-related issues, and sometimes we had a relatively, what you would think is a relatively innocuous thing of some training that we were filming on how to take blood pressures and things like that, and people, you know, there was a question of, can we film that? What if they discover that they have hypertension on film? Is that relevant to the story that we're trying to tell? And, you know, how do we frame that was even part of the question. But I think it's definitely an area that deserves more discussion.
Yeah, that's very true. And sometimes when it comes to developing those multimedia assets also, it's really thinking back to those people that you're also filming. So what would happen, and when are we supposed to stop when it comes to filming, and how to more of merge and start feeling more with the people that you are either developing the product for or actually developing with them. So we've got the final question on how will different multimedia tools and means influence the way we will be interacting with health and social issues and impacting them? Very interesting question, and just I think it really wraps up everything that we talked about today, specifically around multimedia and knowledge co-production. So do you think multimedia would really have more of be a tool in the next generation to influence, interact, support us in actual change at the level of health systems and social systems also?
I think it will, I hope it will get us closer to the public, to the beneficiaries, people we want to influence, because as I said, the worlds are often far away from each other, and a lot of research is developed but never really implemented, and that research practice gap can maybe closed a bit more with multimedia.
And I think, you know, we've traditionally seen multimedia be used as a tool in terms of public engagement, in terms of advocacy, but, you know, maybe moving more from that realm to one of participation, and more inclusive participation, like we've seen, for example, with methods like photo voice or what Jeffrey was talking about with embedded research. There's different ways in which we're moving towards, you know, more participation with, you know, different audiences, rather than, you know, using multimedia to just direct messages at people. And I think that's an important shift and an interesting one, more fun too.
That's true. I mean, both of which, in terms of using multimedia and for advocacy, more of utilizing for the people, with the people also. It's a form of more of a creative and fun way of utilizing also multimedia. Jeff, would you like to add to this question also?
Of course. You know, I think that, well, I mean, I think people, I tend to feel like I may be thinking too grandiose of things about the way that we interact with the world is changing, but I think it is, and even within the last year, I feel like my existence has gone from a lot to sitting very much in front of a computer and everything being mediated through this digital environment. And maybe that's not true for everybody, and I recognize that there are circumstances that enable that sort of interaction. But, you know, with our long form stories of change, for example, I kind of alluded to it in the presentation. We're trying to make use of or lean into habits that people are already starting to have. Of, you know, with social media content, everybody is scrolling. So how do we think about leaning into that and developing content that works for the scroll and still captures your attention or causes you to pause. And so, yes, I think that you know, I've also just gone through our reports from many years that the Alliance has printed in bookshelves, and we're about to move. And I've been instructed to figure out what to do with the publications, but even then, honestly, I think we're looking at how do we represent information in an online way that becomes accessible, that are tailored to different people's needs, things like that. I think that multimedia has a huge role to play in the future in terms of how we present information, how we make information not just engaging, but accessible to a wider audience. So I look forward to that future, I guess.
Maybe just to pick up on what was just said, I see another question was if you were doing your project over, was there anything that you would do differently? And I think probably that, probably, repurposing or reusing some of the content that we have and thinking about, how can we use this in a different way or package it differently for social, for different audiences. I think maybe in some ways, maybe we've, at least for the photo essay, maybe we've even underutilized, what we have. So that's probably what I would do differently.
Thank you for answering that, Adriana. Is there anyone else who would like to answer this question? So I know we have just a few minutes left. If you are to do your project all over again, what would you do differently? If there is anything.
For us, it was very much a learning experience. Sorry to jump in again, but I think we were trying a different type of output, and I've alluded to some of the challenges. Once you get people there and they have a time and a willingness to engage with it, we found that people, it's a very immersive way of telling the story. But even today, trying to, that 5 minutes of kind of giving an overview of here's a video there or here's a video there, it's not the same as experiencing the whole thing. So really thinking about, again, some of the different ways in which it could be repackaged or presented, or how we can get people to engage with the story that doesn't require them to just sit down in front of a computer for 25 minutes is one that I would definitely consider.
Thanks, Jeff. Katrine, so if there's anything, would you do differently, or would you just keep it the way it is? It can't be perfect and kept as the way it is.
Yeah, we didn't reach the end of our project yet, so it's difficult to say.
Okay.
If there's one thing that we would like to have had differently is no COVID crisis, I think.
Yeah, hopefully. Hopefully we'll get through the end of the road anytime soon. Great. So thank you so much today for the session today. It was amazing to hear from all of you. Thank you for all of the attendees that participated in our session today. Two main comments and two main messages just by the end of the session. Knowledge co-production is a really terminology, or more of a process that we really need to work into, and that's something that we heard a lot today. To reimagine health systems, to imagine social systems also. And the utilization of multimedia can be also a very powerful tool to more of influence, advocate, inform, and to change policies, to inform policies, and to implement change. So thank you so much, everyone, and looking forward to seeing you in other times, and hopefully without the COVID-19 pandemic also. So thanks. Bye, everyone.
Thank you so much, Clara.
Thank you.
Thanks a lot.